Okay, John Aloysius. Okay, I'm writing to update you regarding Mr. Aloysius, who was admitted in our hospital due to pulmonary tuberculosis and now ready to be discharged. Your further follow-up care and management would very good purpose. Okay. Mr. Lucius initially presented on this date with symptoms of persistent diarrhea, abdominal pain, rash of elbows, knee, and buttocks. He also reported weight loss and easy bruising on examination. Vitals were unremarkable. Okay, fine. On his next visit, okay, so just write on his next visit, fine, or either you can just write the date. So there is no need to write on his next visit on 1/2/29. Just write on his next visit, fine. Mr. Lucius complained of night sweats, fever, cough, and sputum with hemoptysis. On examination, cachexia and scattered rails in chest were noted. Moreover, his chest X-ray revealed apical infiltration and diagnosis of pulmonary tuberculosis was made. Investigations, acid fast stain and culture were sent, which reported positive for tuberculosis. The patient, see, Dr. Hamza, I mentioned this. There is no patient in OET, okay? He was prescribed isoniazid, rifampicin, pyrazinamide, and ethambutol, along with vitamin B6 supplements. Okay, sputum fast stain came negative, and he was advised normal diet and weekly sputum analysis. Mr. Lucis is now ready for discharge, and his discharge plan includes 4-drug regime for 2 months, with ceasing pyrazinamide and ethambutol after 2 months. Isoniazid and rifampicin would continue for 4 months. Furthermore, they should be monitored for toxicity, visual acuity, and continue taking vitamin B6 supplements in view of the. Okay, so very good letter, Dr. Hamza. Definitely, I'll give you 370 for this one. Some of the mistakes that I would like to explain a little bit about those things to you. Okay, so you can mention the names and the doses. I personally have no problem with it, but if you want, you can skip it. Okay. And to be more specific in the discharge plan, here it is the way you have written. This is good, no problem with it. But to be, if you see your letter is little lengthy, like 3 pages almost. Okay, but you have to make it little concise, little bit. 4-5 sentences could have been removed. So for that, what you can do is first thing is when something is unremarkable in this one on examination, vital, you can skip it. There's no if there is nothing remarkable, nothing appreciable, or nothing which is required to be mentioned, leave it. There's no need to write a sentence, okay, and waste your words. The other thing about the date and the visit that I've said, okay, and rest of the things more or less are fine. There's no problem. And here you have written investigations and then acid. Just write his acid fast stain and culture were sent, okay, which came positive. Or there is no need to write were sent. Just write his acid fast stain and culture were positive for tuberculosis. So these 5-6 words extra that you've written could be skipped. Okay, these are things that you can improve more. Okay, I'm not saying the way you have written there that is wrong. It's very good written, but things can be improved a little bit. Okay, a bit more conciseness needed. Okay. Rest of the things are fine. I won't uh, go in further detail. Okay, that's fine. You can mention that thing. Okay, because if I'll go in for more detail, you might forget your own way of writing, so that would be problematic. Okay, so is there anyone who has sent me a letter and I have not assessed it?